I'm going to call Aimee Afable, and she's going to talk to us about the true diabetes crisis that's right here in central Brooklyn. Let's give it up for her. Come on, you can do better than that. Woo! Thank you so very much, Aimee, for your work. Come. Thank you for your work, and thank you for being here today.
Good afternoon, everyone. I don't want to bore you with all the data, but my goal here is really to contextualize what we're all experiencing in our families, in our community, and to contextualize it within the existing sort of evidence and data that we know, to communicate really how much of a crisis it is that we're experiencing here in New York City. Okay, so I don't have a few slides, but these are the, if there's anything that I want you to take away from here as you leave, these are my main sort of talking points that I'd like you to, take away with you as you leave here. We all already know that diabetes is a global public health challenge, and I'll show you some of that data in a bit. And it's also a huge economic burden on the U.S. economy. And also, people don't know this, but when you compare what we're experiencing here in New York City to the US overall, diabetes is actually more of a serious problem in New York City, and in particular, central Brooklyn. Diabetes is associated with city living, urbanization. And then finally, we also know, as we've heard this theme already early in the conference, that diabetes and diabetes deaths, in particular, in New York City, disproportionately affect people of color, as well as people who are poor, okay? Okay, so as I was saying, diabetes globally is increasing. And this just shows the figures, the latest figures globally, what's going on, right? So, it has gone from, in 2000, 151, let me figure out the pointer, 151, I think this is 151 million diabetes cases in the world, to now we're at 425 million. Okay, so that's a pretty dramatic increase. And then, as I was saying, it's a costly disease. Does anyone have a sense of how much we spend on diabetes? In particular, every sort of variation of diabetes. Diabetes, pre-diabetes, as well as gestational diabetes, the diabetes that women get when they're pregnant. Does anyone have a sense of how much we actually spend on treating and dealing with diabetes? Excuse me, 4 billion? That's close. We spend $404 billion on treating people with diabetes, with pre-diabetes, and with gestational diabetes. And that is the latest figure. This just came out in 2017. This is the latest figure we have in terms of what are the healthcare costs associated with treating and caring for diabetes. Now, to put that in perspective, I was like, okay, what does 404 billion really mean? How do you compare that? How big of a number is that? And so, what I have here is I graphed the cost of diabetes that we have, which is 404 billion. I compared it to the sizes of different countries' economies, okay? And so here you see, here we spend 404 billion in treating and dealing with diabetes in the United States, which is slightly lower than the whole gross domestic product, which is basically the whole, economy of Argentina. It's higher than the entire economy of Colombia, and then of course it's almost more than twice the size of the economy of the Ukraine. So it's pretty large. The burden is significant, and it's something we can't avoid. We can't deny that this is a major problem. Okay, so this reflects the latest data on diabetes in New York City. So the pie chart here, the blue on the left is the proportion of New York City that's not affected by diabetes. That's actually that's about 46% of people without diabetes. Now the purple indicates the proportion of people with diabetes. The orange is the proportion of people that have diabetes but don't know it. The proportion in gray are the proportion of people that have prediabetes, and this large slice of the pie is 33.5. These are the people that have prediabetes, but they don't know it. They're walking around with prediabetes and they don't know it. So basically what this figure suggests is that more than half of New York City is suffering or is at risk for diabetes. And that's pretty dramatic and pretty serious. Again, these are just rates. This is the data showing diabetes in New York City. This is, again, the latest data that we have, where government agencies go out and collect blood from various households throughout, from a representative sample of New York City. And as we heard earlier, diabetes does disproportionately affect communities of color. We see some of the highest rates are non-Hispanic Black, Latino, and actually Asian populations as well. And so all the diabetes rates among all those groups are considerably higher than the rates in non-Hispanic whites. Overall, diabetes rates in New York City are about 16% among all adults. And on this graph, I won't go into detail about the different columns, but basically this data presents the diabetes rates in all of the United States. And again, as I said earlier, here in New York City, we have a more serious problem. So nationally, the rates of diabetes is about 9%, but here in New York City, it's about 16%. So it's almost double the rate of what's going on in the United States. Again, this reflects the wide disparities by racial ethnic group. And as we've known before, Alaskan Natives and American Indian have the highest rates of diabetes nationally. Okay. And then we also know, so the patterns that we see here in New York in relation to what's happening nationally is happening globally. So we know that diabetes is a disease of urbanization, of living in cities. And we know that 2/3 of people living with diabetes actually live in urban areas. And so what is it about city living that contributes to that disproportionate risk, that elevated risk of diabetes? Another theme that I'd like to communicate is that we have large disparities by race. And so here we see that certain centers or certain areas in New York City have a higher rates of diabetes, and these are areas of New York City that we know have been historically underserved. We have South Bronx, East Harlem, and here we are, Central Brooklyn. These rates reflect the diabetes rates from 15 to 22%. Okay, so we're right here in Central Brooklyn. I know within Central Brooklyn, East Flatbush has the highest rates. Okay, and I already mentioned this, in New York City, Blacks and residents of high poverty rates die at twice the rate than when you compare them to non-Hispanic whites and people living in low-income neighborhoods. And then another statistic that I think is important to know and to sort of raise awareness about so that we could get people making the decisions, policymakers, mobilize around this issue is that in Central Brooklyn, which is actually, again, one of the pockets, as I said, in New York City that has the highest rates. In Central Brooklyn, 9 out of every 10 patients with diabetes has an ER visit, which could have been potentially avoided. So again, just a statistic or just a data point to suggest that, people are walking around with diabetes and showing up to the hospital or to the ER too late. And then finally, something I want to communicate, again, the issue that people are walking around with diabetes and really not getting the kind of wellness care or preventive care that they should be getting. We also are suffering here in Kings County and Brooklyn with regard to lower limb amputations. If you see here, this is the national average. Nationally, 4.1 out of every 100,000 people have lower limb amputations, but the rates in Kings County or Brooklyn and the rates in Bronx are significantly higher. So Kings County is like almost 7 times higher than the national rate. Okay, so it's pretty dramatic. It's serious what's going on in Brooklyn. But thankfully, you know, we have hope, and we're going to learn more about the solutions and our vision from Minister John Williams later on in our program. But I want to emphasize that our response is we do have a response that's based on the evidence that we know, the science that we know. It's based on, it builds on the community assets that we see around us, in particular building on the strengths of faith-based health ministries. It's sustainable, and the focus is on pre-diabetes because, as you saw, they represent a significant portion of the New York City population, and we want to be able to prevent that. Thank you.
Thank you so very much, Aimee. That was so informative. We've got so much information out of that. One thing that information will do, it will help you get prepared. So one of the things we've heard so much about the fact that people are getting diabetes so very much in our communities. So one of the takeaways is tell people to get themselves checked and do whatever they have to do to stay healthy, because diabetes has a lot of problems associated with that condition, including amputation and the loss of limbs.